So what are the main trends in e-health in southern countries? Those trends can be a source of inspiration and also something that we can leverage. Florence Gaudry-Perkins is the director of a company named Digital Health Partnerships. And then we're going also to listen to Ganesh Udayasankaran. He's a member of the expert committee at the Foundation Pierre Fabre. He's also a member of the governing committee of the Asian eHealth Information Network. And so they have this very difficult task in only 20 minutes to provide an overview of e-health in 7 countries. So I'm going to give them the floor here at the rostrum. You have the floor.
Good morning, everyone. I think first and foremost, thank you to la Fondation Pierre Fabre and to Béatrice. Our thoughts are with you, Béatrice, for organizing this event every year, because I have to say that it's one of my favorites because of its quality, but also because of its location in the beautiful southern France, but also because of its size. Merci, Lionel. Jai and I are thrilled, in fact, to try to indeed do the challenging task of giving a bit of an overview on where we stand with digital health. We're going to focus specifically on Asia and Africa, just so you know. I just want to say that it warms my little heart to be doing this with Jai, because Jai and I have known each other since 2017, and we've worked on many things together, including the Broadband Commission reports, which was quite a task over the years, and it's the first time we're meeting in person. So it's quite symbolic that we're presenting together, and it's really, really nice. So with no further ado, let's try to get started. What I'm going to do is do a little bit of a global take on some of the big moves happening globally. Then I'll deep dive a little bit into Africa, and Jai will take over and take a glimpse at what's happening in Asia. Okay? Et ça n'a pas l'air de marcher, Lionel.
Well, it seems that the remote control is not working. Well, we always have some form of technical glitch, right? You know, when we test, it works, and then it doesn't. But anyways, it's just working out.
We discussed this at the conference last year, the impact that the pandemic has had on digital health. And I'm not going to stay too long on it, but nevertheless, it's useful to sort of see where we stand with numbers. So somebody used, about a month or two ago, I heard somebody use the word digital pandemic, and I thought, oh my gosh, that's the absolute correct term, because as we were confined, or restricted to move, the world did go digital on us. If you weren't connected, you couldn't work, you couldn't study, and you couldn't seek health care. And hence the title of this slide. So quick look, plus 80% increase in investments in digital health just in 1 year from 2020 to 2021. You can see we're at 57 billion of investments in 2021. Just as comparison, we were at 13 billion in 2018. So you can see the growth is absolutely exponential. In the second figure, you will see that it's expected that the investments will double by 2027 to reach 550 billion. So we are really seeing a major acceleration, and I sincerely believe that it was largely due to this pandemic for the reasons we evoked. Multiple countries, put in tools to sort of track, measure, and evaluate, of course, the virus. So we evaluated that about 50 countries altogether put those kinds of tools together. And then telemedicine and telehealth, we discussed that again a little bit last year. Huge boom in that. Some people were saying that there was more progress on telemedicine 1 month when COVID hit than they had seen in 10 years, right? So we literally saw figures of plus 900% with Ping An in China, but similar figures coming out of the UK, the US, France, and multiple other countries. And even in Africa, there was a huge boost also of not only did existing solutions scale, but there were multiple startups in the field of telemedicine that were started. So telemedicine, telehealth was definitely one of the big ones. Next slide. This acceleration has translated into some major moves from the institutions. So we'll take a look at the bottom ones, which are a little bit global. Of course, Derek, I don't know if you're going to talk a little bit about that, but the digital health strategy from WHO had been in preparation for a while, but what the pandemic did spur was the WHO Berlin Hub for Pandemic and Epidemic Intelligence. So that was a pretty major initiative that got started due to the pandemic. The Global Fund is currently finalizing their digital health strategy, which is a pretty big deal also. I don't have exact figures on how much they've already invested, but know they're increasing substantially also their investments in digital health. And then G7 and G20 started getting quite active and vocal as well, which is very encouraging, and published some very interesting either reports or declarations. And then the EU has been ramping things up also with PRIDA, which is sort of a digital policy and regulation initiative that was largely funded by the EU, and creating also a digital for development hub for innovation. Next slide. So institutional funding, it's pretty hard to measure, and it's challenging actually to have a clear mapping of digital health funding, because a lot of the digital programs or the projects, you actually embed digital inside of it. So people have been asking me like how much, overall from the institutional funding, but it's quite difficult to have a precise visibility on it. But all of them, generally speaking, are ramping up. This is not an exhaustive list that I've put here on the list, but sort of I would say the ones that come up regularly when you talk about digital health. So USAID is one of the more traditional. They've been investing in digital health for a long time. They, in fact, have an official digital health strategy. But GIZ has been really ramping up as well for the last 2 or 3 years, which is wonderful in digital health. And then the traditional World Bank, JICA and ABEL. And then I listed towards the bottom also some of the more prominent foundations who are known to invest in digital health. And lots of new entrants coming in because it's a hot subject, digital health. So, but we'll talk about that a little bit afterwards. The funding is a difficult one because it's also been a cause for fragmentation. I'm not going to stay too long on that, but I pointed to the bottom right on this slide, a very important initiative that was actually done in 2018, which are the principles of donor alignment, so that we stop, so that the donors kind of get together and act more together. So we stop sort of, because digital is really an overarching solution. And so you can't just keep financing little pieces that are not interoperating together. So there's a lot of, and Mathilde Forslund is here from Transform Health. I'm sure she's going to talk a little bit about that, but there's a big push to a bigger donor alignment, better coordination in general. And then on the left here is a very interesting little initiative that many people still don't know about, which is the Healthcare Electrification and Telecommunication Alliance that just launched at the White House about 2 months ago. And this is a 300 million fund, it's like a co-funding mechanism with private sector from USAID. And this aims to connect and electrify 10,000 health facilities across sub-Saharan Africa over the next 8 or 10 years. And super important because it's a little bit more of an ICT play, and we'll discuss that, but without the connectivity, we're not going to go very far on digital health. Next slide. So I'm not sure anyone's going to see that very well, and that's okay, because what this little chart is simply a completely non-exhaustive list of the diversity of players involved in digital health, which explains a little bit on how difficult it is, and also the fragmentation, right? So you've got, academia, you've got the NGOs, you've got the private sector. Within the private sector, you've got health, you've got tech, and within tech, you have multiple different players, and then you have the mobile operators, and then you have the whole health sector, so medtech, pharma, diagnostics, and it goes on and on. And then, of course, all the institutions, some of which we just talked about. And that's going to bring me to the next slide, which I think is probably one of the more important messages that I want to relay today in terms of this sort of overview, is because digital health has increased, as we've just saw, because there's already huge amounts of players and there's a lot of new entrants coming in, we are in desperate need of more coordination and governance mechanism in this space, so that we stop fragmenting, so that we stop duplicating investments, et cetera, et cetera. So to my great joy, this has actually been starting to happen in the last 2 years. We're seeing organizations and bodies emerge to help coordinate better, to help cross-fertilize better, to help inform who's doing what, et cetera, et cetera. And Transform Health that you see to the left, I've actually just mentioned, and Mathilde is here with us. Mathilde, you want to say hi? Who is the executive director of Transform Health, which was started about 2 years ago, Mathilde, now, right? 2 years. And actually well-funded organization, in part by the Fondation Botnar. And there's 3 things that they do is advocate for more political leadership. These are their 3 main sort of strategic pillars. A global data governance framework, which I will talk about a little bit later, and also advocates for increased investments. So they're going to be, you might talk about this later, Mathilde, right? At Berlin, I'll stop there. And to my great joy, because that's one of the things that they do, is also launching country networks and regional networks, is that there's one that was just recently launched in West Africa. And Lionel, I know that you're also attached to this cause. We know, and I will point it out again, that Francophone Africa is behind Anglophone Africa. There's a number of reasons for that. I won't stay too long on it because I don't have the most recent numbers, but I always mention it because it's a plea for us Francophone actors to come and support and do more there. So thank you to Transform Health for launching this network, because it's very, very important. DICE is another one of these sort of coordination mechanisms that got started during the pandemic. So DICE is a bit of it was started by UNICEF and WHO, and it is meant to help, as you can see, coordinate between governments, and then for help donors in development to coordinate with the governments, right, to create this. So they're creating offices for that, and it's essentially insofar been focused on sort of COVID related, but the intent is that it will enlarge to other digital solutions. So that's another very encouraging sign for more coordination. IDARE is another body that was started also more recently, and that's a little bit more focused on research and AI. DCCC to the right is a more private sector type of coalition that also aims for more of this coordination, cross-fertilization, better information. And the Geneva Digital Health Hub is another one, recently started, that aims for these same things. And to the right, and I won't stay on that, to the bottom are the more, I would say, traditional historical bodies. They're absolutely not all there. They're just to show you. The more important thing was this, again, message of this coordination is emerging, but we need more of it, and we really need to support these coordination mechanisms, which are not always the most easily funded and supported types of things, right? Because everybody wants to reach out to how many patients have you touched, et cetera. But I really insist, this is probably my key message for this morning. Next slide. Okay, so now we're going to look a little bit more closely into Africa per se. So innovation booming, investments on the rise. I love this SORMAS example because for years and years and years that I cite up onto the top, I've been saying the innovation is going to come out of Africa. This frugal innovation that's happening in Africa is going to cross-fertilize into our industrialized countries. And SORMAS was a significant one that cross-fertilized during COVID. This is a solution that was a surveillance solution system that was developed originally in Ghana and Nigeria, and it cross-fertilized during COVID in Germany, France, Switzerland, Afghanistan, Papua New Guinea, and Fiji, and it's quickly expanding actually in multiple other countries in the world. We have now 1,276 health tech startups in Africa, which is great. Huge increase. It's booming. And in fact, the investments are as well. The investments on startups in Africa this year, 2.9 billion, 81% growth in just 1 year. Where we have a lot of work left is that out of that number, out of the $2.9 billion that were invested in startups in Africa, only 10% in health. So we have a lot of work to do still. On the bottom, you'll see some of the examples. Very encouraging to see also a health tech incubator, very recently launched also in Kigali by Norsken and the Novartis Foundation. You know, the OECD says there's about 630 tech incubators in Africa, but I don't know too many that are focused only on health. So super encouraging to see that happen as well. And we'll move to the next slide. A quick glimpse of where do we stand with connectivity, because like I said before, if we're not connected, we cannot do digital health. So quick comparison to the right there. Africa is still at 33%, you know, compared to some of the other regions in the world. So quite a bit of work there still to be done. The affordability is still a major problem. As you can see, there's a huge variety across Africa, by the way. In DRC, it still costs 20% of the gross national income to just have 1 gigabyte, to the cost of 1 gigabyte. Now, 1 gigabyte, I don't know about you guys, but when I travel, I use that up in about 1 day. You do 2 or 3 Zooms and do some emails, so it's not much data. And yet, if you were, just so you understand, 20% of GNI, if you were an American, that would mean, on the comparison to the US GNI, that you would be paying for 1 giga of connectivity over $13,000 a month, okay? So just so you understand the reality still. It's not happening across the board in Africa. There are some countries where it's better. I cite, for example, in Egypt, where it's only 0.5%. Kenya is actually doing quite well. Connectivity, you can see that only 26% of people in rural areas are using the internet, way too low still. And we still have 500 million people not using mobile internet in Africa. So yes, there has been huge progress, but still a lot to be done on the connectivity side for us to be completely be able to develop digital health. Thank you, Jai. Very quickly, a glimpse on the maturity of where we stand with what I call the roads. Pierre yesterday very nicely called it the trunk of a tree. I love that analogy. I don't know where Pierre went. Which are absolutely necessary, meaning the national digital health strategies, the governments putting together the rules, the regulations, the standards, the interoperability, the governance, et cetera, et cetera. 34 countries in Africa have actually written a national digital health strategy, which doesn't mean much if you don't implement it. And only 12 countries have actually implemented these strategies. My feeling is that there's going to be a huge push towards that because of all this acceleration that I was describing to you. And very hopeful for that because it's really fundamental that this happens. From a data governance perspective, which is also extremely important. So we're talking about data security, data storage, data exchange, data privacy, et cetera. And COVID has, of course, accelerated the need for this protection because during COVID, we had to exchange all this personal data. And so the good news is it is accelerating. There's many countries that have actually enacted new laws also since COVID, but the reality is that there's only half of the African countries still who have actually passed the legislation on this front. So still progress to be done. And since we're talking about governance, I'm going to hand the mic over to Jai, who's going to tell you a little bit more about that. Thank you.
Thanks, Florence. I think everyone agrees that in digital health, a lot matters in terms of data governance. So without having that, it's difficult to achieve, also provide safe digital healthcare. And Transform Health Coalition released this health data governance principles on just recently, a couple of months ago on 7th of April. And then this was evolved organically, and then it went through different stages of review and then contributions from a lot of experts, regional organizations. And then we had this 3 broad pillars that is protecting people, promoting health value, and then also prioritizing health equity. And these principles, like they are not in conflict with any of the existing ones, because there have been other efforts as well. In fact, WHO organized the summit on health data governance last year. So these principles are not in conflict with anyone, and then these have been endorsed by over 100 organizations, and then many countries. In fact, recently there was also a meet in Geneva during the World Health Assembly, and then many countries have shown interest to actually endorse these principles and adopt them as well. So this is something that is very interesting. And then this main salient feature that I would like to highlight is this brings this lens on health, human rights and health equity. And then of course Matilde is here, and then if you want any further information regarding health data governance principles, you could contact her. And let me move to the Asia. Like Asia in terms of the trend, a bit of a trends of what is happening in Asia, and then move over to what we are practically doing from a regional network point of view, which I'm representing today, AHIN, Asia eHealth Information Network. And in Asia, the trend is like there is a rise in health ecosystems. And then, for example, like I've given some examples from Asia, like that includes Indonesia, India, and China. You could see that these ecosystems are already catering to about 1 billion people. And then what's happening is like there is a trend that people prefer to have single touch point in healthcare. And this could also include digital. And this is something that we found in Asia. Like a lot of people, especially after the COVID, and they are very comfortable to have this digital touch points. And Asia, like it's a region of many variations. Like I would like to come about it a little later, but then like we do have less number of doctors for 1,000 people. So when compared to the OECD countries, and then the population is also aging. By 2025, we are expecting to have over 450 million people who are senior citizens. That constitutes about 10% of the population. That naturally means that the demand for healthcare is going to actually rise. And then the digital health, in terms of digital health value, like by 2025, it's going to be about 100 billion, the value creation. And as I said, like the region is very diverse in terms of the culture, the healthcare systems, the language, and even the regulations also vary. And we have half the world's internet users are based in Asia. And then the government spend about 4.5% of the GDP, which is comparatively low when compared to many of your countries. And then governments foot the bill about over 60% in terms of health expenditure. And then, I think I'll move over to the next. And then this also brings to the point, like I think Florence also highlighted, there is also a fragmentation, and then there needs to be a coordination. But before that, we need to have a mechanism, because I'm sure that most of the countries have regulations enacted decades ago. They are not suitable for this digital health environment currently. They are meant for health, but they're a bit archaic. So innovations usually tend to have conflicts with regulations. And to amend the existing law takes years, typically. Like for example, India introduced this bill on personal data protection in 2019. It is still being debated. I'm sure that many other countries in the region as well as elsewhere also have the same problem. So what this trend is emerging. This is not something new. This was used in fintech, but this concept is now actually coming into digital health, where we have this regulatory sandboxes, and then where we have a very safe, controlled environment, where we have this new technologies being applied under the approval of the regulators. And then if it passes, then they are empaneled into the services, whether it is application. And then also this actually keeps the risk, takes care of the risk, as well as balances the pace of regulations. So these 4 examples is what I'm able to say, but there are more. But these are prominent examples. One from Singapore, they started in 2018, and then India, 2020, it's known as National Digital Health Sandbox Environment. And then we also have from Indonesia, and then they focused, I think, starting with malaria, but then it's also extendable to other environment as well. It's not only not only for malaria. And then Malaysia has also started. And then many countries are also taking the example of Singapore, and then also having this kind of tie-up and having this knowledge exchange. And this is something that is happening in the region. I would suggest any country moving into innovations actually focus on having this kind of regulatory sandboxes in the country. And in terms of digital maturity, a lot of efforts have gone in Asia. And then we from Asia eHealth Information Network, and then in 10 years of learning from a network point of view, we suggest a simple framework known as governance gaps framework. That's governance, architecture, program, people and program management, standards and interoperability. There are multiple frameworks, of course, but in our experience, most of the problems or issues or challenges related to digital health could be related to these four. And then we have already had this assessment done in 2017, and then now we are doing 2.0 right now, with 13 countries already sending their preliminary feedback, and then this is an ongoing exercise that we will conclude in the month of October, when we are having the annual general meeting, where we will release the the regional assessment. And we are also tied up with Health Enable, who has this global digital health indicators, and then we are working with them closely. And then currently, in fact, like we had this Asia workshop, and then they work with other regions as well, especially Africa and LATAM. And then having this kind of standardized indicators actually helps to keep track of where the country is in terms of maturity. In fact, like it also gives the confidence to donors and development partners what to invest and which countries to invest. So this is something that again I suggest, and these are the countries like who are the early adopters. I'm focusing only on Asia. It's happening in other regions as well. And then again, like we found one problem with in the region, that is multi-sectoral coordination is very much lacking, and that is very, very essential. And that is where EHIN also brings this concept of convergence workshops, and we have worked with 7 countries so far over the last 7 years. And then our role being a regional digital health network, we are not a corporate body, and we are a very neutral body whose mandate is worked together with the WHO country office or the regional offices, and then also the ministries of health. So we basically help them convene these varied stakeholders, because typically what happens is it's not just Ministry of Health alone who makes the decisions in terms of digital health investments especially. So usually the ministries of IT or telecom, and then some countries now also have this Ministry of Digital Economy of late, they are having this. And then also sometimes we also have this post and telecommunication or other ministries. So we try to bring together multiple ministries who are relevant to digital health, not only the ministries, the academy, the professional societies, because in some countries, the professional societies in health and digital health or informatics play a major role. We try to bring everybody on the same page and then have the National Digital Health Strategy Roadmap being built. This is something that we have done. This kit is published by Asian Development Bank. How to do if any countries or anyone would like to conduct similar convergence workshop, like you can refer to this toolkit, and then also you can contact. We are willing to share this experience, and then in fact the development partners have approached us to take this experience beyond Asia. We are actually actively working with one of them right now to do it in the Middle East. And then this is my last slide, and basically this summarizes EHIN's goals. Like we want a stronger networking, and then we want to we are already working with our peer networks in Latin America, and then Africa, and then Pacific Islands. And then we believe in actually co-creating the projects, because languages could be different, but then the underlying issue or the topic is the same. And then we believe in peer learning, sharing, and support. And then we have this mantra from EHIN that encourage cooperation, enable collaboration, ensure coordination, and then endeavor convergence, which I talked about, the convergence workshop, and that leads to an experience that is coherent. Because in terms of digital health that spans multiple domains, we need a coherent approach. Thank you very much.
So a very, very quick conclusion, because Lionel was giving me the big eyes. So these are kind of the key things that we want to leave you with Jai, on sort of, you mentioned the trends, what's happening, right? There are multiple challenges to be addressed, but here are the key ones that we think is this need for more coordination and governance. I insisted on that earlier. There's the need for more government leadership. We talked about only in Africa, for example, but it's the same for you, I think, Jai, in Asia, right? And in fact, I realized I skipped. I just want to go back to Africa for a minute, and it's important. The African Union is about to publish a digital health strategy. CDC Africa is ramping up, about to publish a digital health strategy. Smart Africa, digital health blueprint, be on the lookout. This all goes back to the government leadership, because all of these things are going to help us push governments. Need for capacity building is huge. I won't stay too long on that. Fondation Pierre Fabre finances already a degree. COB is here, but there are a few more, but we need more and more people to be touched. The push for Internet for all, I think I don't need to stay, I already presented the slide, still efforts on that. We're hoping the Smart Africa initiative will get ICT ministers, at least in Africa, way more involved. And this increased emphasis on equity and inclusion, Jai, you just talked about that. It's very interesting, and if you can skip to the next slide so they can visualize it, it's the hot topic. I've always thought it was all about that. I said, digital to me equals access, but that's the big words. And you see the headlines to the right, you see some seminal reports to the left that have just published. Everyone is talking about those two words, inclusion and equity. So we'll leave you at that. There is the Dr. Tedros quote there. Did you want to say 2 words only? Because Lionel otherwise is going to about the IT report.
Talked about the Broadband Commission report on virtual healthcare. And
micro, Jai, le micro, voilà.
How telehealth is picked up already in countries. And then this ITU, WHO ITU standard on accessibility of telehealth services is very important. It was just launched on June 16th, and a lot of traction is already happening. For example, Derek is here from WHO HQ, and we are already working with Government of India, which has this largest national telehealth service in the world. And then we are actually collaborating with them to have this standard actually incorporated into the application. So that will make a lot of difference. Thank you.
Merci à tous les deux. Restez avec nous juste une toute petite minute. On peut les féliciter parce que c'est un travail.
Thank you very much and congratulations.
Sorry, I just forgot to mention that I talked about the convergence workshops, and 5 days from now, the Foundation Pierre Fabre team is going to be in Laopedia to actually follow up on supporting the country in terms of digital health strategy. Just wanted to mention that. Thank you very much.
Restez juste une toute petite minute et on peut vraiment les applaudir parce que c'est un travail qui est difficile à faire, qui est complexe à faire. Et dans lequel on sent qu'ils ont mis tout leur cœur, leur passion et qu'ils avaient envie de nous le communiquer aujourd'hui. En tout cas, on en retient que ce soit dans le Sud comme dans le Nord. Depuis 2 ans, les investissements en santé digitale sont exponentiels et sont des fonds d'investissement. On est sur une tendance qui maintenant est durable. La digitalisation de la santé est complètement lancée. On n'est plus en train de parler d'un tout petit précaré ou d'un petit corner à côté de la santé. Non, elle est en train de se digitaliser. Et les choses vont augmenter dans les prochaines années. On retient, et c'est aussi un des thèmes principaux de ces journées, que si les investissements sont exponentiels, en face de nous, on a des structures qui peuvent être parfois isolées et on a un monde qui doit aujourd'hui se consolider, se rassembler, et c'est l'une des grandes réflexions que nous allons mener tout au long de cette journée. Et enfin, ne pas oublier que si la digitalisation de la santé permet de rapprocher les personnes, de rapprocher les malades et de rapprocher les soignants, elle peut aussi créer des divergences et créer des mondes qui se séparent, malheureusement, que l'on ait accès à Internet ou pas, physiquement, financièrement. Et on voit aussi parfois ce schisme qui peut se passer sur des continents, que ce soit en Asie ou en Afrique, où on voit une Afrique anglophone très avancée dans sa digitalisation et une Afrique francophone un peu plus à la peine. Ça fait beaucoup réagir nos internautes, votre intervention. Je ne vais pas poser beaucoup de questions, mais je voudrais saluer Corinne en Côte d'Ivoire qui nous dit « Nous, en Côte d'Ivoire, nous, agents de santé, avons besoin d'un centre de e-santé ». Voilà, le message est passé dans cette journée. Billon de l'université de Cocody, qu'on salue au passage, qui nous dit la e-santé, il a raison de nous le rappeler, ce n'est pas simplement de mettre des ordinateurs dans une salle, c'est un peu plus que ça. Et puis il y a cette autre question que je voulais vous poser très rapidement, si vous voulez, à l'un à l'autre de cet internaute qui ne nous a pas dit son nom, mais qu'on salue quand même au passage, et qui nous dit, y a-t-il beaucoup de partage d'expérience entre les innovateurs et chercheurs en santé digitale, entre l'Asie et l'Afrique, parce que vous avez bien présenté la situation sur chacun des continents dans une vision très macro, mais est-ce que ça communique beaucoup ou est-ce qu'on est sur 2 systèmes de recherche encore séparés? Jai, au micro, voilà, merci.
We do have the relations with regional digital health networks in Latin America as well as Africa, like for example, African Alliance. And then we also have with ACFI, African Center for eHealth Excellence, based in South Africa. So we do have such relations. We do invite each other for our events, and we do collaborate, especially in terms of normative guidelines or any publications that we do. We already have this collaboration happening, and in fact, we have worked across, like for example, Health Information Systems program also to actually do the curricula. So we have worked together.
Ah, merci. Voilà. Beau message d'espoir et de coopération. Merci à tous les deux de cette intervention. On disait, hein, ce spectre de la santé digitale, il est large, il est complexe, il est sensible.